Could you briefly introduce yourself and share your background in health informatics?
Yeah, sure. So my current day job is Professor of Digital Health and Care at the University of Wales, Trinity St David. Before that, I was a reader in health informatics at University of Portsmouth. Before that, a lecturer, and before that, I worked in NHS IT for about 15 years, and then ultimately did a PhD in health informatics, which led to my academic career. And then through BCS, I'm currently the chair of what is now called the BCS Faculty of Health and Care.
And as a chair of BCS Health and Care, it seems like you've been crucial in shaping the fields of informatics within the UK, especially with the recent collaboration between BCS and the Faculty of Clinical Informatics to form Faculty of Health and Care Informatics. Could you share your vision for this new organization? How do you see it supporting and advancing the healthcare informatics community in the UK?
Sure. So obviously we're very pleased to be working with former members and working groups of the FCI, and we're delighted to now have the BCS Faculty of Health and Care. I think it's an opportunity to kind of reach what was always a common vision that was shared, I think, between FCI and the BCS, which is about recognising the multidisciplinary nature of our field. Is not something that can just be left to technologists, nor is it something that can just be left to clinicians. And of course, we also have to think about citizens. So I think it's a great opportunity to kind of rethink how we do this as the National Society for our profession in such a way that we're inclusive, we're collaborative, and we are influential, so that we are seen as a source of expertise and a source of authority, if you like, in the field.
Following on that, what topics would be at the forefront of the discussions in the conference?
So we've deliberately chosen a theme that relates to us, our role as a professional body. So it's about developing the profession to transform the service. And it recognises the fact that digital transformation, as we call it, isn't just caused by technology. We have digital tools, we have digital enablers, but fundamentally it's about people being able to do their jobs better, hopefully, as a result of those innovations. And so we're really focusing on how we equip people to get the best out of digital transformations, to whether it's in design, whether it's in implementation, whatever aspect people are thinking about. There's a very broad role for us as a profession to be recognised and to be developed. So
there are kind of specific topics that would more commonly be dealt with, especially in this year's conference?
So we've invited leaders of national programmes from across the UK to give us their insights. So I'm pleased to say that we have Sonia Patel from England, we have Helen Thomas from Wales, and we have Dan West from Northern Ireland, who were able to come and present. And I think that's an interesting strategic perspective from national programme leads. And it will be interesting to see the similarities and the differences between their approaches. And we also have contributions from across both BCS specialist groups and also our allied bodies within the Federation of Informatics Professionals, for example, from IRIM, the Health Record Managers Group, who are presenting. So the idea is, again, to kind of showcase the cross-disciplinary nature of this work.
Who do you think will benefit the most from participating, coming to the conference?
So whether they're clinicians, whether they're technologists of some kind, whether they're members of the public, whoever they are, it's getting involved in it that's really the crucial thing. So I can't emphasise enough the importance of seeing this as a multidisciplinary field. And it's that sharing of expertise that brings the benefits, I think.
So it seems like anyone from kind of junior doctors, clinicians, nurses, any other kind of therapists, anyone from that spectrum to kind of system analysts and software developers, you know, they are all welcome to the conference, it seems like. What key takeaways can the attendants kind of expect from the conferences?
Well, I'm hoping that we can provide, as I say, a showcase of the multidisciplinary nature of this, and perhaps give people an idea of the opportunities to get involved. We've got a certain number of working groups on particular topics already. As I say, things like social care, mental health, nursing, primary care. It would be nice to see new things emerging. We've already started the transition of some of the groups that were in FCI, for example, patient safety and digital medicines. Well, the one specific thing that we have in the conference is a workshop about what the future of the faculty needs to look like. So that is going to be the beginning of a consultation period leading up to Christmas.
I've also heard another exciting news that the EFME, the European Federation for Medical Informatics, is also organizing a conference in collaboration with the BCS. So this is definitely something that we can also look out for. But specifically, from your perspective, what are you most excited about for this event? Medical
Informatics Europe is the name of the conference, and it's held annually by EFME, as you say, the European Federation for Medical Informatics. It was last hosted in the UK in Manchester in 2017. So this is the first time for several years that we've had it in the UK. So this conference is in Glasgow in May of next year. And I and others are very busy in organising the various things that have to happen. We've got an open call for papers. So we're now accepting submissions of full papers and panels and workshops. So I'm sure along with this interview, we can share the URL for that so people can have a look at the site and see what the exact dates and process is for submitting to that. I think it's, again, a great opportunity for UK people working in health and care informatics to engage with the broader international community. So although it's European primarily, these conferences always attract people from around the world. For example, the recent MIE in Athens, we had a lot of people there from North America, South America, Asia, Australasia, Africa. So these are genuinely international events where we can build really powerful professional connections and see opportunities for collaborating beyond our small island.
And finally, I just wanted to end on an even brighter note and say congratulations to your recent appointment as Vice President of the International Medical Informatics Association, IMIA. So how do you see this new role helping the BCS and the UK kind of to have a stronger voice in the international development of health informatics?
Yes, thank you. Well, obviously BCS has been very involved on the international level for many years. BCS was a founder member of both IMIA and EFME, and we've always had representation at the international meetings over the years. But I don't think we've, certainly in living memory, I don't think we've had anybody from the UK on the international board of IMIA. So I think it's a good opportunity to try and raise awareness of some of the many good things that have been going on within the profession in the UK. But also, again, as I say, to learn from others, to have that direct connection with the IMIA working groups, the IMIA board as it sets its international strategies, and also the important role that IMIA has with the World Health Organization, I think, again, is a big opportunity for UK to get involved in. I had a discussion already at the last IMIA board meeting with our World Health Organization representative about a particular commission around CPD materials from IMIA from World Health Organization to IMIA. And I think that's certainly an area where there's synergy with work within BCS and FedIP. So, that kind of opportunity to be recognised on the global level, I think is great for BCS, great for FedIP, and the broader health and care community in the UK.
Hearing all that, it seems like you are actually really crucial in shaping the fields of informatics, not only within the UK, but now also globally. Do you have any final note or message to tell the audience before we say bye?
Sure. Well, hopefully see you in London for the conference in October, and beyond that, hope to see you in MIE in Glasgow next May. Great opportunities. Please join in.
Great. Thank you so much.